Murphy, single vehicle car crash incoming, 2 victims, husband and wife. You want in?
Yes, I would like that very much.
Motor vehicle accident. The other victim's behind us. 41-year-old female, lacerations to her face, contusions on her chest and abdomen. She was behind the wheel when she lost consciousness.
She has 3 centimeters full thickness scalp plaque extending to her hairline. Heart rate's normal. Possible internal bleeding. What are we doing, Dr. Brown?
Fast ultrasound?
Get on it.
45-year-old male, superficial abrasions to the neck. Appears that he's dislocated his hip.
Affected limb is in position of flexion and internally rotated. We need to relocate the hip.
Do it, Captain Morgan. How are we doing?
There is a lot of free fluid in the rectal uterine space and Morrison's pouch from internal bleeding.
Let's get her into R01. When you're done, join us, Dr. Murphy.
Okay.
Where are they taking my wife?
She has internal bleeding, so they are taking her to surgery.
Today is our 10-year anniversary. Tell them not to let her die. That woman is my everything. She's all I have. Oh!
We use a small tool called a laparoscope, kind of like a metal straw. We go in through here, here, and here. Everything gets tucked back inside, and we're done. It only leaves a few small scars.
How long have you had a stiff neck?
A couple days.
Been feeling tired or have back pain?
A little bit of both, I guess.
I'm going to test your reflexes. Left patellar reflex is minimally responsive.
What's that mean?
We might have to postpone the surgery.
We're gonna run some tests. If everything checks out and we figure out why you have pain and fatigue, we'll operate.
Come here, bud.
Spleen and liver are fully packed. Where's all this blood coming from? Suction. How's the hubby?
His hip has been relocated. He asked me to tell you not to let her die. She's his everything.
Duly noted. Retract the stomach.
Can't find the bleed. Hold on. The left fallopian tube is swollen. And there's a large defect in it. It's ruptured. Your wife is gonna be fine. She had a ruptured fallopian tube. Mr. Williams, unfortunately, we couldn't save the pregnancy.
The fertilized egg implanted outside the uterus.
Pregnancy?
It was fairly early. She may not have told you, may not have even known herself.
That can't be. I had a vasectomy 10 years ago, right before we got married. I need to see my wife.
Mr. Williams, that's not possible. She's sleeping. She needs to rest.
There's no way she was pregnant. You guys made a mistake.
No.
We didn't make a mistake.
She's not like that. If she gets the wrong change for coffee, she's driving back 20 minutes to make it right. And the sex? We haven't been this active since our honeymoon. Maybe the vasectomy failed.
I'm sorry, but a vasectomy doesn't just fail after 10 years.
It is more likely she got pregnant from someone who is not you.
It's not possible.
Did you step out on me?
That's absurd. You're my everything. What could I get from anyone else?
You could get pregnant.
I didn't have an affair. Maybe one of Todd's swimmers got through. I heard it happens. It must have happened.
It's unlikely, but I suppose not impossible. We can test Todd's sperm count.
This is local anesthetic. You'll feel a pinch.
Are you a real doctor?
I'm Dr. Shaun Murphy.
People ever call you Murph?
No. I'm going to make a small incision so we can insert the tube and reinflate your lung.
What do they call you, Billy?
Craterhead, volcano, 3 eyes. Those are just the creative ones.
Hold tight. Here comes a tube.
guys really know what you're doing.
Yes, we do. We'll order an MRI for your lungs, then we will fix your fractured eye orbit. That will require surgery.
What do you say we fix your forehead too?
You could do that.
I think so.
I don't think so. It's a pre-existing condition, and it's not medically necessary. It shouldn't be approved.
The MCA clot is obstructing all distal flow.
Anti-androgens aren't indicated for hyperplasia. He said atypical.
You think he's lying?
Maybe he's gender transitioning. Aside from cancer, there aren't many other indications.
Let's focus on what we do know. Feeding the catheter, suctioning the thrombus, and he's recanalizing, slowly retract. Whatever his reasons are for taking anti-androgens, hopefully there are options. He either drops them or he's going to keep having strokes.
The forehead repair would be expensive and cosmetic.
But it's not about prettying him up. You could give him a new life, friends, maybe a few less beatings.
Stopping the beatings is the guard's job.
You really don't have any empathy for Billy.
Empathy is a bad reason to fight for someone. If empathy makes me only want to help patients who are from Wyoming or have ASD, then that's very unfair to all my neurotypical patients from Idaho.
How long you been at Foothills?
9 months. Time flies in juvie.
Any visitors?
I don't have a granny bringing me cookies, if that's what you mean.
This is why empathy is bad. You're talking to our patient because you like him, which is causing him to move, which is affecting our imagery.
He's scared. I'm talking to him to calm him down, which is improving our imagery. And the fact that I like him is beside the point. You grew up in San Jose?
East Pally. But I got out of there as soon as I could. I was 15.
Your parents still there?
Mom's gone. Your old dad is terrible.
Siblings?
My little brother. He's gone too.
Happy dad. Lost his brother. I mean, you really don't have
He's
it.
not scared. He's short of breath because his diaphragm is lacerated. His stomach has passed through that tear and is now in his chest. Billy needs emergency surgery on his diaphragm.
The defect reaches all the way from the center to the anterior costal margin.
So what do we need to do?
Divide the inferior pulmonary ligament to bring the lung upwards.
Ash? Whoever kicked him was wearing some serious footwear.
And they'll be waiting for him when he goes back. Unless we help him.
Dr. Park wants to fix his forehead.
The Constitution guarantees prisoners get the same care as everyone else.
Most non-prisoners can't afford cosmetic surgery. He would be getting better care than everyone else.
Kid is smart and personable and puts up a great front, but he's scared to death. And he got 36 months for selling weed, a crime that doesn't even exist anymore. You think his life would be anything like this if he didn't grow up with a massive dent in his head?
Sorry, I'm not convinced.
Is that because you don't have any empathy for Billy?
No, it's because I agree with you. It's expensive, risky, and unnecessary. But empathy can be an invaluable motivator, Dr. Murphy, that truly connects the physician with their patient. Is he still up there?
Yes.